And don't forget about tone and reflexes. And here today on this EMU stage, I am officially condoning the use of the stethoscope as a reflex testing tool. And here's why. I'm going to introduce you to this absolute legend, Sir William Gowers. This is a British neurologist, affectionately known by many of his colleagues as the greatest clinical neurologist of all time. And in 1879, he actually proposed the use of the stethoscope as the stethohammer technique for reflex testing. So the next time someone gives you side eye for using your stethoscope, I want you to confidently look them in the eyes and say, you are following in the footsteps of the greatest clinical neurologist of all time, Sir William Gowers. But why do we care about tone and reflex testing? Well, it tells us whether or not spinal shock is present, and spinal shock is that temporary loss of spinal cord function following an acute injury. Think about it like the spinal cord stunning that happens from contusion or edema, which could be partially or fully reversible. So when you have absent reflexes, spinal shock may be at play, and we have to be very cautious about premature prognostication. And when it comes to sacral reflexes, I'm going to encourage us to use the anal wink instead of the bulbocavernosus reflex. You're already doing the DRE for these spinal cord injury patients. All you need to do is provide some stimulation around the perianal skin and watch for that involuntary contraction of the anal sphincter. This is much quicker and less intrusive than the bulbocavernosus reflex, which requires you to compress the glans penis in a male or the clitoris in a female, if you can find it.